Well, hello everybody, and welcome to Outbreak News TV live stream. Haven't done one in quite a while, so I appreciate you watching. And what I want to do today is, the website, the YouTube channel, the podcast, they're all revolve around different outbreaks and different infectious disease situations across the globe. But in order for me to do everything that's going on across the globe now, I would have to spend all day here, and I clearly can't do that. So what I wanted to do today was start out on the continent of Europe and go over some of the different outbreaks that are going on there and different other types of infectious disease situations. And let's go ahead and start in France. And there's a couple of stories coming out of France that I want to touch on. The first one is the dengue fever situation, and there's quite a bit of imported dengue in France right now, much more than previous years. And the main vector in the country of France is the tiger mosquito, Aedes albopictus. Now, this mosquito first arrived in France and found its home or became established in 2004. Now, in 2024, that mosquito is now found in 78 of the 96 departments in the country of France. So it's all over the place, and you can see on the map there's just a dozen or so departments in the northern part of France where it has not been established yet. So that's becoming an issue in that country. Now, the Aedes albopictus mosquito, or the tiger mosquito, of course, is a vector for the same types of diseases you'd get from the Aedes aegypti mosquito: dengue, Zika, chikungunya. Now, what's going on in France with dengue now is they're just seeing all kinds of large records of imported dengue so far this year. And this, we can actually take it back to last year. In all of 2023, France saw more than 2,000 imported cases of dengue. And I believe they recorded some local transmission also last year. Of all the 2,000 cases of imported cases last year, 1,500 of them, or about 75%, were imported from the Antilles. Now, this year, just in the first, not even 4 months, going through about April 19th, there's been almost 1,700 imported cases. And if you compare that to the same period last year, there was only 131 between January 1st and April 19th last year. So, yeah, we're seeing a massive increase, and it shows no sign of slowing as of this point. Now, this year, more than 80% of these imported cases are people that have returned from destinations in the Caribbean, like Martinique and Guadeloupe. And there's also a percentage coming out of Guyana. These are all French departments. One of the concerns, of course, is the Paris Olympics coming up in a couple months. So, health officials are warning of the issue of dengue in France, especially with this large influx of population coming into the country. Well, there's one more piece of news out of France that I wanted to talk about. And yeah, Lassa fever was just reported in France. And this is a disease, of course, that is not normally found in France. It's endemic in parts of West Africa. It's spread by rats. And the patient apparently is a soldier who had recently returned from abroad, and he's currently in a military hospital in France. The health officials, media, nobody's reported exactly where he was, where he contracted this disease. The Ministry of Health in France is saying they're performing an in-depth epidemiological investigation to determine persons who have contact with this individual. And they say there's no cause for concern in France general. Now, if you're not familiar with Lassa fever, this very dangerous virus got its name from a town where it was first identified in Lassa, Nigeria, back in the 60s. It's very, very common in Nigeria today, and it also pops up relatively frequent in other West African countries like Guinea and Liberia, Sierra Leone, and some other countries not quite as close as Nigeria. The fatalities are substantial. It kills about up to 6,000 people every year in West Africa and infects up to 300,000 people. Health officials basically say, this virus circulates almost consistently or constantly, especially in Nigeria, which is, of course, the worst of the infected country. So, yeah, we'll be keeping an eye on that and see if there's any kind of hospital spread or any other kind of spread in France with Lassa fever. So, yeah, that was kind of a big story that came up earlier in the week. And let's switch over to Spain. And in Spain, this is not new to them. They've had cases in the past, but in the Junta de Castilla y León, they have confirmed a case of Crimean Congo hemorrhagic fever in the country. The case is an elderly man who was admitted to the Salamanca hospital, and he has a history of a tick bite. Currently, he is stable, but because of the potential severity of this virus, isolation measures and protection of the healthcare people around him are being provided. So, another very serious disease. One of those diseases like Lassa that are on the World Health Organization's, top 10 list of potential, really very dangerous organisms. Crimean Congo fever, if you're not familiar, is a virus. It's caused by the Crimean Congo hemorrhagic fever virus. It's mainly transmitted via the ticks of the genus Hyaloma, but it can be transmitted person to person through contact with blood or fluids of an infected patient. So it's a big issue for healthcare personnel to take care when treating a patient with CCHF. All right, let's move over to the Czech Republic, and they are being slammed this year with whooping cough or pertussis. And the Czech Republic is, right now, they are seeing the largest outbreak of pertussis in more than 6 decades. So yeah, it's really big. Suboptimal vaccine coverage and, of course, waning immunity, which is affecting a lot of countries around the world, are two of the things that are being pointed as a blame, or at least a partial blame, of this large surge of pertussis in the Czech Republic. So through April 28th, so essentially the first 4 months, 10,973 pertussis cases have been reported. Of that, 148 were reported in children less than the age of 1. And children of that age are by far at the most risk of severe disease and death from pertussis. Currently, there's been 3 fatalities in the Czech Republic, 2 in elderly people, and 1 newborn that was less than a month old. And 2 of the cases had co-infections with bacterial infections, like say strep pneumonia. Something to just remember when we're dealing with pertussis, because we are, and I've covered it on different podcasts and on the website, out in Asia and in Europe, where you're seeing a lot of cases, is that you have to remember that the vaccines do not provide lifelong protection against the disease. And any kind of immunity that you have does wane. So it's really, really important to revaccinate. And it's very important for pregnant women to get vaccinated. So sticking with pertussis in another European country, Croatia is also seeing quite a bit of pertussis this year. And this is from their Ministry of Health. And actually, as of yesterday, they have reported almost 6,500 cases of whooping cough throughout the country. And health officials are saying the largest number of patients recording cases are in the city of Zagreb, or Zagreb, I may not be pronouncing that right, and the county of Split, Dalmatia. So, and it's not just these 2 countries. There's others in Europe that are also being hit by it. But in particular, the Czech Republic stands out to me. And they're just, like I said, more than 6 decades, more than 60 years since they've seen this much pertussis. Okay, let's go a little bit north into Scandinavia, into Finland. And Finland health officials are reporting an increase in Yersinia enterolytica infections so far this year. And this, of course, is a gastrointestinal infection, and is typically foodborne. And what health officials are seeing is 168 Yersinia enterolytica cases have been reported to date. And this compares to 64 during the same time period last year. And this is one of those cases that cause diarrhea, sometimes severe diarrhea. And you're also likely to see abdominal pain, fever, and the symptoms usually last 1 to 3 weeks. So it takes a little while to get through it. A lot of times this is related to pork, chitlins, so you need to cook your meat fully. And sometimes it's through vegetables, and vegetables need to be washed very thoroughly. And if you're handling raw meat, or if you have contact with animals like pigs, make sure your hands are washed really, really well. So, and this is an interesting organism because it does. It's able to grow well at lower temperatures than other bacteria. We occasionally do see this in as a contamination of blood units for transfusion. So that not as often as foodborne, but it does happen sometimes. All right, let's move on through our trip through Europe here, and we'll go to Denmark. And Denmark is also in the middle of a salmonella outbreak. And this is where we're getting from Denmark health officials. Since mid-March, 40 patients have been registered ill with the same type of salmonella. It's been identified as a salmonella of the type Typhimurium. It's about 24 men, 16 women, no travel history. They haven't eaten at any of the same restaurants or taken part in any kind of events together. So the suggestion is that the food is something that's coming from supermarkets across the country. An epidemiologist there in Denmark at the Statens Serum Institute says we are working to find out what is to blame for the outbreak. Preliminary investigations indicate that the source of infection could be minced meat sold at supermarkets. So, yeah, so that's just another investigation. And foodborne investigations are very, very difficult. I've talked to many epidemiologists throughout my career, and this is one of the toughest ones to narrow down. Let's go ahead and again move on one more time. If you have any comments, please do let me know where you are. If you have any expertise on any of these outbreaks or these organisms, I'd love to have you on. And but let me go ahead and move on. I'm going to go back up to Scandinavia. And in Sweden right now is reporting an outbreak of Mpox in the city of Stockholm. Now, just last month in Stockholm, at least about 10 cases of Mpox or monkeypox have been reported, and they're all considered local cases. They all were infected within Sweden. The public health authority in Sweden is working with regional health authorities to investigate the increase. Right now, they're saying it is mainly men who have sex with other men. And they're just recommending, if you're at a high risk group, to get vaccinated for Mpox. And the two groups they're really talking to for vaccination are, of course, men who have sex with men with an increased risk of Mpox, and trans people who have sex with men, and also people who have sex with men for compensation, so male prostitutes. So that's going on, after a real lull in Mpox in most of the world, with the exception of some parts of Africa. So that's one of the headlines coming out of Stockholm, Sweden. All right, let me go ahead and move on over to the United Kingdom and England and Wales. And we're going to talk about measles here. And in England, since October, over 1,100 measles cases have been confirmed. This outbreak was initially driven by a huge outbreak in Birmingham, but officials are saying that has slowed down. That's much better now, more stable. And now they're seeing the rise in cases in the London area. Now, a epidemiologist with the, I don't know if they call it in England, the health ministry, they're saying the number of measles cases are rising across the country, with a particular increase seen in London in recent weeks. We know some communities in London have a very low MMR vaccination rate. measles, mumps, and rubella vaccine. Measles is preventable, but many thousands of children around the country are not fully vaccinated. And this is a very effective vaccine. It's up to like, what, 97% effective if you have both doses. And it's pretty long term also. And they're just warning that, there are risks. Measles can be dangerous. There can be very serious long-term and serious complications. So that's what's going on in England. And if we go to the neighboring island of Wales, health officials there are saying that measles is spreading in the community of Gwent, and they confirmed 9 cases just recently. So parents, of course, are being urged to get their kids vaccinated with the 2 doses of MMR. Public Health Wales is working with the local health board to identify contacts, and looks like all the patients are receiving appropriate care. So everybody seems to be doing okay. But I mean, and you can check out some of the long-term complications, some of the serious complications. Yeah, you don't see a lot of fatalities in the United States or Europe, but you do see a lot of fatalities in Africa. So it's still clearly possible. Yeah, the health care you may be getting in Africa may not be at the same standard of the US or Europe. And that may explain the fatalities, and also a lot of times, malnutrition and issues like that play a part. But yeah, measles, nothing really to scoff at. A lot of people like to, but it's really not. Let me switch over to go back on the mainland in Germany. And we have an outbreak in Germany of norovirus. And there's a norovirus outbreak at a festival in Stuttgart in southwest Germany. And they're saying the number of people affected as of few days ago is 815. It looks like the people got infected, caught it in a marquee at the festival last couple weekends ago. It's not clear how the virus was first contracted, but officials right now do not believe it's linked to food or drink served in any of the festival tents or anything like that. All the samples they've tested have been negative. So they think it's probably person to person, but still it's not clear whether the original source is a visitor or was it an employee. But norovirus spreads very, very rapidly. It doesn't take a lot. And like I said, yeah, the number of people infected, according to officials in Stuttgart, say the count has reached 815. Yeah, as Sarmed says on YouTube, 815 is a big number. Yeah, it's a huge number. Now there's going to be, this festival still goes on for, I don't know, 2 or 3 more weeks. So it's pretty huge, and there's like 1 million people that eventually show up throughout the whole thing. So we'll see if this continues to spread, but norovirus is notorious for spreading pretty rapidly. So yeah, thanks for the comment, Sarmad. And let me go ahead and close with our last European country, the last European outbreak. Now, this is not all inclusive. Clearly, there's a lot more stuff going on, but this is what I'm able to get through today. And my plan is to do other live stream outbreaks. If there's a lot of stuff going on in the continent, I'll do it by continent. And if you know somebody who'd like to come on and talk about any of the stuff, let me know. I would love to have people come on and chat. Okay, Sarmad has another comment. Let's see what he has to say here. Retrospective cohort study or the outbreak investigation is mandated. So yeah. So news about this outbreak is going to continue to come out long after this festival is over. So we'll definitely be keeping an eye on that. Very, very curious about the source of this outbreak. And let me see. Let's go to the Netherlands. Now, the Netherlands and Norway is going through the same thing, and a lot of countries around the world are seeing an increase in sexually transmitted infections. And syphilis has been notorious as of recent, but now we're seeing a lot of gonorrhea showing up in a lot of places. And in the Netherlands, they're seeing a significant increase in gonorrhea in 2023. Netherlands officials report a 31% increase in gonorrhea compared to 2022. And the interesting thing they're seeing is the increase is greatest among women and heterosexual men under the age of 25. With a lot of these increases we're seeing around the world, especially with syphilis, a lot of times it's between the increase is seen in men who have sex with men. But here with this gonorrhea outbreak, they're seeing a lot of increase in women and heterosexual men. And this is the second year in a row that the number of young adults who tested positive for gonorrhea has increased. Now in 2023, there were more than 13,800 gonorrhea diagnoses in the country. This is an increase of 31% compared to 2022. And like I said, although gonorrhea is still most common among men who have sex with men, this increase in young women and young heterosexual men is particularly striking, health officials say. And they say this mainly concerns people of high level of education and without a migration background. So these are locals, young people, college educated. In 2023, the number of gonorrhea diagnoses among women increased by 78% compared to 2022. So it went from about 1,500 to about 2,600 year to year. And among heterosexual men, it increased about 51%. So yeah, these are big increases in these, especially in these populations. So of course, abstinence is best, but that's not always going to happen. So make sure you wear appropriate protection for something like gonorrhea, which would also protect you from chlamydia and syphilis and other sexually transmitted infections. All right, well, going to close it out here. And for the YouTube channel, if you aren't part of the YouTube channel, go check it out. You can go there. It's Outbreak News TV. So you can always follow me there, subscribe, like, comment, share. I got about 670 videos up. A lot of them are old interviews I did when I had a radio show several years ago. Then since about 2017, there's a whole bunch of podcasts interviewing different experts and advocates and all kinds of people on different great issues, interesting issues of infectious diseases. And I also do some news. I've been doing a lot more news clips lately, just on little things that are going around. They're very short, 5 minutes or whatever. And also, if you're interested, you can always check out the website, and that's scrolling across the bottom. It's a Substack. I used to be the editor of the website Outbreak News Today, and I gave that up and just started doing basically the same thing on the Substack. So it's outbreaknewstoday.substack.com. Go there and subscribe, and I try to post several news stories or informational pieces daily. There's the Outbreak News Interviews podcast, which you can find on all your platforms. So Apple, Spotify, Amazon, pick it. I'm on probably about 15 different platforms, so you can check that out. Those are all audio, though, just to let you know up front. You can follow me on different social media. Of course, Facebook, it's called Infectious Disease News. On X or Twitter, it's BacTman63. Or you can find me on LinkedIn. I actually like LinkedIn quite a bit. That's a really good social media channel for this kind of stuff, at least in my opinion. I get to meet a lot of really, really good people in this community. So LinkedIn's good, and just look up my name. All right. Again, I appreciate you watching, and I'll see you next time on Outbreak News TV.